Our goal is to make even a poor physician, an average physician, into an excellent physician, and make an excellent physician a superhuman physician, because it's going to reduce cognitive load dramatically when it's helping you with all these tasks, which will really help you think better.
Welcome to the Imagine AI Live podcast. I'm your host, Chris Madden, and today we have with us a very special guest, Bhargav Patel. Bhargav, how are you doing?
I'm doing terrific. How are you, Chris?
I'm great. I'm in Minnesota. It's the afternoon. I'm pumped and ready. Where does this call find you?
Providence, Rhode Island.
Okay, so you're an hour ahead of me in the day here. Great. Well, let's get into it. Can you please introduce yourself to our audience and tell us what you're working on?
Yeah, so as you mentioned, my name's Bhargav. I'm a physician. I'm also an entrepreneur, and I'm part of the founding team of Sully AI. And we're building medical tools for physicians, Agentic AI tools that help them produce and help them with patient visits, writing notes, end-to-end support all throughout the physician journey.
Amazing. And so Sully AI, what's its one line? What is it doing for people?
The one line, so it's Agentic AI teams for healthcare.
Who are your clients? Like, who are your ideal clients?
So we have over 400 healthcare organizations currently. And so we have organizations as small as solo providers up to 400 plus physician organizations that are providing healthcare to a wide variety of people.
Amazing. And like, what's one of the coolest use cases you can think of people using product?
I think healthcare is going to be one of the industries that is most transformed by AI. And that happens for a variety of reasons. There's major inefficiencies in healthcare. It's a massive industry, and there's massive opportunity to really improve patient lives and improve efficiency. So one thing, the most common thing that's out there today is AI scribes to help physicians write their notes. The number one cause of physician burnout today is actually documentation burden. So AI scribes promise to change that. But what we're trying to focus on is just beyond just AI scribing. So we have an AI scribe, but we have agentic teams that do a whole variety of things, like can also serve as an AI receptionist for physicians' offices. It can also make phone calls to insurance companies and a variety of tasks. We also have clinician support throughout the patient visit. So it's going to help them review the chart and save time in terms of chart review. Sometimes charts have hundreds and hundreds of notes, and physicians spend extensive time going through it and finding information. But with our team, we have the agentic AI that will review that as well as other things throughout it, such as billing and coding and other features.
That's amazing. And so how did this company start out, and how long has it been around?
So Sully AI launched in spring of April 23, I believe, was the founding date. So the two founders, Ahmed Nasser and Ahmed Omar, actually came up with this originally. And I actually met them about a month or so after they started the company. And so it came out from their original idea, from their experiences with healthcare. And I actually connected with the founder within the first few months, and then played a partial role early on, and then have joined in a much more active role as the medical director over the last year.
So it's been around for almost 2 years, if it's the spring of 2023.
Yes.
Tell us your origin story and your road to joining Sully AI.
So by training, I'm a physician. I'm currently a physician fellow doing research at Brown University. I worked in child and adolescent psychiatry, so that's my background training. I also did an MBA during my residency training, specifically because I was interested in healthcare administration and the healthcare system, which you don't really get much direct training on in physician training. So I've always been interested in tech innovations for healthcare because of all the inefficiencies that I've seen in it. I've always wanted to do something that can scale in that environment. And so it's something I've always been connected with, something I've always explored and gotten a good bit of experience in. So that's how I originally got interested in this area. That's my background. And so when I met the founders from Sully and we worked on it, it was really a good fit of backgrounds and experience and skills.
So yeah, I mean, you're trying to bring efficiencies to a very inefficient system. I mean, there's a lot of complaints about the U.S. healthcare system. And I wonder if you could paint a picture of like the inefficiencies of where we're currently at. And is it something like a sixth of our GDP is people spending money on healthcare, and we get some of the like lowest, results on average compared to other developed countries? And if you could tell us where we're starting from here.
Absolutely. So healthcare is, I think, above a fifth of our GDP at this point. projected to approach a fourth of our GDP at some point, which is insane considering we have the largest GDP of any country in the world. We're spending more on healthcare than countries' whole GDPs, most of the countries in the world's total GDPs, which is staggering considering, we don't have the greatest or highest population in the world by any means, yet our spending is out of control. That's really accelerated over the last few decades. It was not this much just 50 years ago. It was a much smaller portion of our GDP. And so the question is, what is causing the rising healthcare costs? And what are these inefficiencies? Really, the inefficiencies are almost everywhere. I think part of it stems from a byproduct of a capitalist system where there's huge fragmentation. There's a bunch of private insurance companies. There's some government play in healthcare. There's a bunch of private pharmacy benefit managed. There's so many layers to that system. And in a sense, each part profits off of inefficiency, right? The inefficiency is the profits of many players in the healthcare industry. So unfortunately, it's actually a byproduct of the capitalist system, why we have such an expensive healthcare system.
Well, that was very well laid out there. So something needs to happen. And if we're not taking those different layers, merging them together or whatever, that's a kind of a different question from what you're working on. You're bringing efficiencies to a doctor's job and bringing kind of organizing the data for patients and having like a one place where their data is organized and saved for patients and for doctors?
Yeah. So what we're trying to do is with these agentic teams that will help in healthcare, we're trying to make every aspect of the physician journey easier. So cut out all that documentation burden, cut out all the administrative inefficiency that plagues healthcare, and directly benefit the physicians and the clinicians themselves. So when our tools will help them write their notes, it'll help them manage their office, it will help with billing. So all things that will save time during the day. The average physician seems to save about 2.8 hours a day using Sully AI. And that's across, we have tens of thousands of physicians, approaching tens of thousands of physicians at this point. So they're saving on average 2.8 hours a day. And that's not counting the receptionist and other things. So that's just on notes and the assistants during and before visit. And then we're about to release a new feature that's automated chart review, which will only save that time further, where the AI is going and reviewing the chart and helping them sift through that information much faster.
So the question that came to my head was, where are these cost savings going to? Are they going to the patient, or are they just going to help ease the burden on the physicians and they can more profit?
So in terms of the time saved, if you look at the industry that's providing like AI scribing tools and stuff right now it's largely going back to the physicians. What most people don't know is most physicians after work, it's called pajama time. They spend time in their pajamas sitting there writing notes while watching TV or hanging out with their kids. And they're spending hours in the evening just with that documentation burden. So first, it's giving them that pajama time back. It's giving them their evenings back so they can spend it with their families. They can spend it doing the things they enjoy and can recharge, so we don't have such an epidemic of physician burnout. Some places approaching 20-30% of physicians are reporting burnout, which in a workforce that's already limited is a major problem. Physician burnout leads to more errors. It also leads to worse patient care and not great for the physicians.
How does one get started with Sully AI? What's the onboarding process like?
So, they can just go to our website and then fill in their information. A member of the team will reach out, show them a demo, show them how everything works, and explore which areas they're interested in. Are they interested in the receptionist, the scribe, which AI agents they're most interested in? And then they'll get them onboarded for that. We do have full integration with electronic medical records. So it's not something you're having to copy paste from one platform to another. It's integrated with the electronic medical records. So it will directly put in the notes and everything into that. So that requires mapping. So our team will also set up a time for the mapping and a timeline for that mapping to get your electronic medical record fully integrated.
How does it work actually with the data protection and keeping these medical files? What's the standard practice nowadays before AI?
Yeah, so we're fully HIPAA compliant, so it can be used by any healthcare organization. All the data is fully protected with military grade encryption, so it is secure and it can work with any healthcare platform.
So what AI are you using then to do the organizing analysis?
So we actually use a consensus model. We just put it out on preprint recently, our paper on that. And so it combines the intelligence of various models to actually give more accurate and less overconfident outcomes. So one of the challenges with large language models is overconfidence. They may spit out things overconfidently that are blatantly wrong at times, but by using this consensus model, it's going through multiple layers of analysis, preventing these overconfident outcomes more of the time and also improving actual accuracy. We've recently benchmarked it, and it was superior to all of the publicly available large language models on several healthcare benchmarks.
Cool. So the doctor not only describing and like improving efficiencies with paperwork, you can also ask it questions based on the patient's data and history. Talk to it like you would an AI doctor.
Yeah, not only can you do that, so we have a consultant, we have a researcher for doing research for you, but during the visit, while you're talking with the patient, like Sully is active, it's listening to the encounter, but it can also pop up suggestions for diagnoses you may not have considered. It can pop up questions you may have forgotten to ask. It can also give recommendations. You can generate treatment plans while you're there in the room with the patient. It'll give you alerts if you were about to prescribe something that they're allergic to that it detected. So it's helping you all throughout the patient visit and supporting the clinicians all the way from start to finish.
The percentage of your customer, like your customer breakdown of like, are there any just like single practice doctors using this, or it's the clinic level, but then getting higher? Like, what's the biggest fish you've caught as far as implementing this around with a lot of people?
So our current largest signed organization is over 1,000 providers, actually. So we range from solo providers to massive healthcare organizations, where currently our sweet spot is actually mid-market, ranging to several hundred physicians is where really hitting the mark right now, from 20 to 300, let's say, physicians. But we're moving into larger enterprise deals, as well as we have plenty of solo providers as well. But we're really mid-market and above.
Amazing. And how big is your team these days?
The size is constantly changing, but I think we're past 20 at this point.
Wow. And where are you guys in the fundraising? Are you VC backed or bootstrapped?
Yes. So we raised a Series A in January. We raised 15 million at a $75 million valuation.
Wow, congrats. And that is just in January, so about 6 months ago. Exciting. So what's the road, this just makes sense, right? I mean, somebody's got to do this. And this is one of the inspiring things about AI and how it could really benefit our society and people's lives. What are the roadblocks that you see, the hurdles that you got to overcome? What's the roadmap here?
So there's several things. So the roadmap long term is we want to exponentially improve healthcare. Our mission, our tagline is one human, one doctor, where ultimately there will be personalized AI for every single person. Right now, the ratio is far worse than one human, one doctor, and we have major shortages of physicians and healthcare professionals, but we want to make it so we can increase efficiency to superhuman levels that every human could have their own doctor. And that would be the long-term mega vision. But over the next few years, the roadmap is really expanding our agentic AI teams to basically help automate every aspect of healthcare that can be easily automated, while simultaneously making those AI teams also help augment physicians in all the tasks that they can be augmented, basically improving the efficiency of care, but also the quality of care and reducing patient errors as well as saving lives.
I suppose it's a matter of awareness and conversion to implementing Sully AI in your clinic. And like once you do and you see the benefits, I mean, it's going to be hard to think of stop using that. I mean, I suppose if there's another competitor like Google or something release something, maybe they'd switch there. But I mean, is that how you see the competitive landscape?
So in terms of the competitive landscape, it depends on what dimension you're looking at. So if it's just AI scribing, there's a lot of companies out there. Most of them are just LLM wrappers, which just listen and scribe the note, right? It's a very easy thing to build, but sometimes the note quality is very poor. Ours is excellent. But in terms of the competitors in that regard, AI Scribe, there's a lot of competitors, including Microsoft has Nuance DAX, which is their AI scribing. One of the other big players in that industry is Abridge, which is also AI scribing. But our full suite of features goes far beyond that. So we're offering the receptionist, the rest of the AI agentic teams, the clinician support, all of these features which go beyond some of the current just AI scribes. So in the AI scribing landscape, lots of competitors, but in terms of full end-to-end patient journey and physician journey, there's very few competitors, if any.
How about the like images and video? Like I recently like uploaded this like scratch I got and I was like, what should I do about this? And AI chat GPT told me. And I was like, oh, that's very reassuring. And I'm wondering how much video and photo is used in your product.
We're currently not using any video like recordings at this point for like the patient care aspects of it. In terms of photos, so physicians can, and like the consultant or the researcher, upload photos that
Okay.
the AI can use for whatever research that they want to do. Like let's say you upload a picture of a rash and like it's going to research about what that rash looks like and what it could be, or for example, but it's not directly used during visit.
Yeah, so not during the visit, but what about like x-rays or CT scans that are uploaded for the patient? I mean, you get analysis of that.
You could certainly do that. I mean, similar to how you could into a typical large language model, how we wouldn't necessarily recommend using that as your sole judgment for especially clinical purposes and safety purposes. You would want those images read by a radiologist.
Is there something about your an aspect of the company that I haven't talked about yet that you'd like to share?
I think where we're really trying to change the game is in how we're supporting clinicians. And with clinician support, we're really reducing errors. And our goal is to make even a poor physician, an average physician, into an excellent physician, and make an excellent physician a superhuman physician, because it's going to reduce cognitive load dramatically when it's helping you with all these tasks, which will really help you think better. So we always want the physician or the clinician to be there as the human in the loop, because ultimately that's what provides for the safety of the whole experience and the empathetic human aspect of that whole experience. I think there's a lot of, let's say, hype in the AI field about replacing doctors, replacing lawyers, replacing professionals. But I think the real success will come when we augment those professionals, where we can keep the human aspect of it at the things humans do best, and then let the AI do what AI does best. And rather than spend human resources on what AI does best and AI resources on what humans do best, working together, we can really improve care across the board. And that's our goal at Sully.
Yeah, I think that's well said. I don't think that first human contact point and the physician visit still really important, and that we know what we're uploading to it. And then the endpoint too, like being, told by the physicians reviewed everything and they know everything that Sully AI is using, and then like reviewing the output too, and then delivering that to the patient. It's still really important. You're always going to need humans for that.
Absolutely. And I often give the example, I'm like, planes are mostly flown by autopilot today, but I don't think anyone's going to really want to board a plane with no pilot on board.
Have you had any pushback from healthcare industries, doctors about this technology?
Surprisingly, healthcare organizations and physicians have been, and I'm more surprised on the healthcare organizational side, they've been very receptive to these technologies and faster than healthcare usually moves. I think a big part of that is healthcare organizations know how much of a physician burnout and provider burnout problem they have. They know how many people are leaving because they're burnt out. The workload is too much. And so they've been very receptive to tools that can change that. Of course, there is resistance because to some degree across any health tech innovation, because healthcare needs things to be safe. They want to make sure it's not going to harm patients. And so that's a reasonable resistance that should be there, and I think should always be there when it comes to health tech. And that's why we have physicians that are actively involved in the development of this and the building of this, because we want it to take care of patients at the end of the day. We want it to be safe for patients at the end of the day.
Yeah, definitely. When you say clinician, what does that mean? Is that the person that runs the clinic or the people at the front desk, or?
Clinicians, just more inclusive terms. It includes physicians, nurse practitioners, physician's assistants, anyone that's providing care to the patient, but will broadly cover all the clinicians that do that.
Have you seen any interest from the insurance industry into your technology?
There has actually been interest from the insurance industry as well. So insurances also employ physicians sometimes at their own offices, or they have like on-call physicians, as well as physicians that use various tools, like when they're doing prior authorizations or they're doing physician doc-to-docs about approving care. They will often have a physician call and have a discussion. So these tools can also be used in those cases to help reduce the admin burden and write up those reports.
I feel like you've got to get the insurance industry aligned with all of this too. And I mean, if you're saving doctors 2.8 hours a day, things should get more efficient and the costs should go down. And I know that's the big tackle is like, we got to decrease the costs of our healthcare industry.
Absolutely.
Do you have any further thoughts on other, you're doing your part. What can other people do, or what can our government do their part to help make healthcare better in America?
I think, having studied this pretty extensively, I don't think there are any easy quick fixes. Quick fixes always sound appealing because it's like a broad generalization that seems like it could fix the whole system, but we have to accept that healthcare is a very massive and complex industry with hundreds, if not thousands, of different layers to it and players in that market. There's the pharmaceutical companies that are making medications. There's the researchers. There's the pharmacy benefit managers, the insurances, the government payers, the quality care organizations, the hospitals, the physicians. You're looking at so many different players in this. So on one level, there's many different fixes where you're picking at specific things. I would say one thing that truly could transform healthcare is actually make it a true capitalist system. And while that may sound counterintuitive because it's partly what's driving up costs, but the problem is healthcare does not have price transparency. You cannot figure out what anything you are trying to get in healthcare costs. If that was transparent, all of a sudden prices would start going down because there would be direct competition, just like there is in every other field. So it's actually pseudo-capitalistic, and hiding behind vague prices or lack of price transparency is the very reason costs can be charged at ridiculous rates. And having that would immediately drive prices down.
Yeah, brilliant. And that seems like something that could be signed by an executive order, or something that can just be decreed from above. That you got to start marking all these different layers, like whatever you're being charged. Can I ask somebody how much this is going to cost?
Yeah. And if you've ever tried to ask in healthcare, it's almost impossible to get an answer. No one can give you the answer. The physician can't give you the answer. The hospital doesn't give you the answer. Your insurance company won't give you the answer. Nobody even really has the answer, which is the problem. If there was clear set pricing, it's pretty easy. You go to one hospital and they're saying a knee replacement is $5,000. The other hospital, it's $50,000. And those stark price differences do exist. You can literally get them for $5,000 at some hospitals and $75,000 at others. And what drives those costs? It's that vagueness in pricing. But if they were listed just like you're buying something on Amazon, I don't think anyone's going to be buying the $75,000 knee replacement.
It reminds me of what Mark Cuban's doing with the cost plus drugs and doing generic drugs and having very transparent pricing. And it is having a big impact. And his business is doing well, I think, because it is transparent. They just, have the clear markup of what they're making.
He's transforming the industry. I think that is a great thing that he's doing with cost plus drugs. Pharmacy benefit managers, which for a lot of people who don't know, a pharmacy benefit manager is in between. It's a middleman. They don't necessarily do any part of the whole service, but so there's pharmacies which provide the medications, there's pharmaceutical companies which make the medications, there's insurers which pay for it, and providers or physicians that provide the care. The pharmacy benefit managers are in the middle. They create formularies for hospitals or insurance plans, and they actually are cutting so much cost out of the middle. They've gotten a lot of heat lately from Congress, and every state, I think, has passed a law targeting PBMs over the last 5 years. But so that's where Mark Cuban saw a huge opportunity. He's like,
because these PBMs are doing, these middlemen are doing what?
There's a bunch of techniques that they use to pull money out of the system. They're getting rebates from the pharmaceutical companies for these drugs, and then they may pocket those rebates, or they're adding costs. So pharmaceutical company may sell that drug for $5. By the time the pharmacy sells it, they're selling it for like $25. And the pharmacy benefit managers are taking a huge chunk out of the middle. And not only that, they're not passing on those savings or rebates to the customers or the employer health plans that they're creating formularies for, or all of the other players along that. So they're a huge way that costs are going up. And they're also driving independent pharmacies out of business because they will reimburse their own pharmacies more and other things along those lines.
Well, I think we've identified two clear targets for helping at the higher levels, these PBMs, people, these middlemen, and then the transparent pricing. I mean, that can't be that hard to push through. I mean, I'm sure it'd be a very popular thing, a very popular thing. So I think we've covered your company really well and the benefits that it's having to clinicians. And I'm wondering about the other ways AI is impacting the healthcare in general and like the hope that we have here, because I've seen a lot of stories. I wonder where you are paying attention to.
As I mentioned, I think healthcare will be one of the biggest transformations that AI will provide. I think another one will be education, with personalized education. But in terms of healthcare, there's almost every layer that can be improved by AI because there's so much paperwork, so much documentation, administrative work throughout all segments, the billing side of healthcare, the billing agency side of healthcare, the physician side, the nurse side, everywhere. So it can improve that massive amount of documentation burden that's really been added on since the advent of electronic medical records. Most older physicians complain about how things are today. Like they enjoyed practicing medicine exponentially more just 20, 30 years ago before electronic medical records became a big thing, because now they're sucking out most of the time, right? For example, you may spend 5 minutes in the room with the patient and 20 minutes documenting and putting orders into a computer for that patient. So you're spending 70% of your day not seeing patients and just doing a bunch of paperwork, which is not what people who went into healthcare went into it for. So I think that's a huge area in which it'll improve healthcare. But I think beyond that, it will improve the safety of care. We'll identify safety hazards that are not identified today. We'll catch more errors. And on the other side,
Preemptive healthcare, perhaps.
absolutely, preventative care and all of that should improve with this because it can get more personalized to individual patients, including like wearable technologies as they get better and better, like Aura, Whoop, all those technologies. They can help monitor things in real time. And then with AI suggestions fully integrated with your doctor and other things can really improve long-term preventative care. Now, there's not much evidence out there for that right now because they're all still relatively new, but that will be there. It will also improve drug discovery and like personalized medicine over the long run, where we can create drugs that are more targeted for specific gene types and specific things once we can use AI tools to identify and speed up the drug discovery process.
Amazing. Yeah, I think you're right. Education and healthcare are the two. It's going to be golden age with AI and the amount of new things and capabilities we'll have as individuals and for your family just to be able to get cutting edge care and attention based on where you're at from the education level. It's fascinating. So any not rosy picture, like what keeps you up at night thinking about AI? What are you worried about?
So, I mean, there's the things that all the philosophers and the AI doomsday predictors say about AI. I don't think they keep me up at night, but there's concerns about AI not having proper alignment with our goals, and or while trying to achieve those goals actually does a lot of destructive things that harm us. I think with the current state of AI, that's not really a concern, but more of the concern right now is the overconfidence it has, the spitting out things that it says very confidently, but are actually quite inaccurate, as I'm sure most people who have used AI today can experience. And we're working really hard to reduce that, the AI overconfidence with our consensus mechanism. But I think that's one thing, just really improving it so it's not spitting out wrong answers that people are believing.
Yeah, well, and you've got to, I mean, with people's lives in the healthcare industry, you've got to make sure that there aren't any mistakes or it's not overly confidently telling you to do one thing that, like human doctors, a good chance that you shouldn't do that. And, lay out those percentages for people. I think it's really important. How are you keeping up with all this AI change? I mean, that's for me the thing. It's just like it's getting exponentially better. There's tons of products out there. It's a huge space. It's going to affect every vertical. And still, I think it's early where a lot of people aren't using AI. They've heard about it, but they're not using AI. And how do you as a company keep up with all the updates and the new models and use it to improve your product?
Yeah, you really got to separate the signal from the noise when it comes to AI. There's a lot of hype, a lot of things out there, but we have world-class engineers, and our engineering team is top notch, fantastic. And so they're really doing the hard work of separating all that, really improving on it, creating innovative new mechanisms for how to get these better outcomes for what we're trying to build. And so they're working on that and thinking about that every single day.
Finally, what's your marketing strategy and like social media platforms? Where can people find you?
At this point, generate the most traction through LinkedIn because we can directly find the people that are relevant in healthcare versus other social media platforms. So that's our number one use platform in terms of getting the word out there as of right now. But we've had incredible word of mouth, just people going and telling, after using it, telling other physicians. Physicians know other physicians. And once they love something, they spread the word. And that's really helped a lot with our growth.
Yeah, I think that word of mouth is the best ROI you can get if somebody tells you about a product and they're satisfied and happy with it. So, well, congrats. I'm very happy to have been able to talk with you. It's a fascinating industry. I've read about Sully AI for a while now. I'm glad to hear you guys had a new round of fundraising and are supercharging ahead. So is there anything else you'd like to leave our audience with? And then also how to find you?
You can find me on LinkedIn, but anything else for the audience? Nothing in particular, but I would say there's a lot of hope for how AI will change healthcare for the better in the future. And I think people will see just over the next 5 years how much better their experience of healthcare gets.
Well, Bhargav Patel, it was amazing talking with you. Everyone check out Sully.ai. And I'd love to get an update 6 months from now because this field is moving so fast. So I hope to talk to you again.
Absolutely. Looking forward to it.